Okay, so in this video, I'm holding some stickers here. I would like to show how to locate some of the important urinary bladder points. Urinary bladder points or bladder points, same terminology, okay? I'd like to start from probably where UB11 is. I want to talk about the inner line and then the lateral line or the outside line of the bladder channel. And then we'll do a few in the mid-back, thoracic, and then we're going to go and do the lumbar a little bit. And we'll stop there just to give a taste of how to locate that. So if you have seen the previous video where we talked about finding a way around the body with palpation, then let's look again and find T1. Urinary bladder 10 is actually within the area of the base of the head. Okay, I'm not putting a sticker obviously because it's in the hairline, but I do want to make a point that the upper trapezius muscle attaches here at the posterior neck. Just between that aspect of the muscle to the mastoid process, you guys are going to be able to find a little bit of a pronounced depression just off the bone of the skull. Okay, that is gallbladder 20. To our discussion, bladder 10 is going to be on the actual muscle, described as about 1.3 tsun lateral to the midline. Okay, but honestly, if you just put your middle fingers here, you'll be able to sort of like bunch that tissue together, and we have muscles that come from the what we call part of the erector spina, the neck extensors on the right and on the left. If that's the midline, we can really feel that tissue bunched up together. Bladder 10 is going to be right within that belly of the muscle. It has a little bit of a achy, nervy feel to it when it's being needled or compressed. Okay? Now, for our purpose, we want to talk about how to find bladder 11. Bladder 11 is level with T1. Okay, so I'm going to take my fingers and palms and compress the spine a little bit. I'm going to utilize my left hand, so we know that no ribs above my fingers. All ribs, or the first rib is going to be below my finger. So I'm going to start feeling, oh, that's a spinous process, probably either C5 or C6. Moving here, that's another one right there. And then that might be C7. If I go one more, that's T1. That started to be a little too low for C7. So C7 has to be here, which makes sense to me. Now T1, if that's here, we can put one point here. That's the midline, right? Part of the Dumai. And then let's look also to find ourselves the medial border of the scapula, right here with that arm position. That's the inferior angle of the scapula. So the medial border is right there. I'm actually pushing it away right through there. So we know that the measurement from the medial border of the scapula to the midline is 3 tsun. So if we take those that distance, now we know exactly where is the 3. That means that 1.5 is going to be right here. So if that's the spinous process, or the bottom of the spinous process of T1, then right here, again, let me double check, right there. Sorry if I'm a little rough there. Yeah, you can see that's 3, that's 0, 1.5, you can maybe argue slightly more here. That would be our bladder 10, which usually is in line with the erector spina cords, or the muscle cords. And this is where I would put that one. Let's go and count. Let's also mark this one as T1. Okay, the bottom of T1 is right here. So bottom of T2, right through there. T3, T4, T5, T6, T7. Not always, but sometimes. I would like to say there's an understanding that T7 is oftentimes in line with the inferior angle of the scapula. Not always the case. Maybe more when the person is upright. In reality, they can have different variations here. Okay, I want to double check myself. I use 2 fingers, so I leave room for the spinous process in between. That's T1. That's going to be T2, T3, T4, T5, T6, T7, okay? Bladder 17, which is a command point for the blood, is going to be half between the 3 tsun mark, right there, on the belly of the erector spinae. So we're right there. T8, T9, by the way, T8 there's no bladder lines. T9, an important point, that's actually UB18. It's the back shoe point of the liver, right there. You good? Am I palpating too strong? Good, okay. 19, right there would be gallbladder. 20 would be spleen. 21 should be right there. That's for the stomach. And there's, if we did a good job, I hope, we'll see, then we should find that the 12th rib is right around there. So it attaches to the 12th rib right here. So I might be a little bit low right there. Okay, let's verify ourselves. If we go here, and that's L5, right? L4, L3, L2, a little congested here, L1, and T12 is a little higher, it's actually right there. So maybe not the best demonstration, but you get the sense of how to find yourself around the spine. And again, we want to be aligned with that 3 tune out, so we're about half. You can also feel the cord of the erectospinal muscles, and that gives you the sense that yes, you're on that line of the what we call the inner bladder line. There are points of the urinary bladder on the lateral branch, right there, 3 tune out, that correspond to the same levels, and they have some similarity in their function because of the segmental relationship with the organs underneath. So for our discussion right now, I just wanted to give some sense of how to work with finding points on the back as it relates to the urinary bladder channel. Alrighty, thank you.